welcome back to the Modern Pain Physician. I'm your host, Dr. Kent, and today we're going to talk about treatment options for spinal stenosis. So in our previous video, we talked about the causes of spinal stenosis, so if you haven't seen that video yet, make sure to start there. But next, most people want to figure out, how do we treat it? And so spinal stenosis is usually, as a physician, I'm trying to look at the imaging that shows stenosis or that narrowing, and then trying to see if the symptoms that the patient is experiencing fit with what I'm seeing on the imaging as far as that area of narrowing. And so when I'm thinking about spinal stenosis or symptomatic spinal stenosis, I'm thinking about pain, basically patterns that go down the arms or down the legs in very specific patterns that correspond with where a nerve is getting pinched. And so, for example, if you have a pinched L5 nerve in your low back and you have pain going down the leg in an L5 dermatomal or an L5 pattern, then I'm thinking that that is a symptomatically pinched nerve from symptomatic stenosis. And so the treatment is usually injecting along that nerve to do two things. To first diagnose the problem. Is that where the pain's coming from? And so injecting local anesthetic along the nerve and having that pain go away, it tells me that that's the problem area. That confirms that that's where the pain's coming from. In that injection, typically we'll put in things like steroids, and a steroid, what that does is it resets that nerve. And so when a nerve gets injured, irritated, it sends pain signals, and that steroid will cause that nerve to stop firing for a period of time and reduce kind of the inflammation, excitement of that nerve, and should reduce the pain. But what we don't know is how long that pain relief is going to last for. And so when I speak with folks after an injection targeting spinal stenosis, what I'm looking for is during that numbing medicine, did the pain get much better? Confirming that that's the problem. And two, how much relief did you get with the steroid? And then we kind of see how long that relief lasts for. Depending on the degree of relief, how long it lasts for, that kind of determines what we do next. And so when we start thinking about things, treatment options beyond injection therapy for spinal stenosis, we're now starting to think about either doing some sort of spacer, which is an indirect way of taking pressure off that nerve, or even getting you to a surgeon to do a direct decompression, or things like a laminectomy, laminotomy. You hear of the microscopic decompressions, endoscopic decompressions. These spacers or indirect decompressions involve wedging things in between the bones of the spine, just to prevent compression or pressure off that nerve during certain activities. Vertiflex is a classic example, but that has since gotten taken off the market. So there are some other things, I think Coflex, some other options out there where you basically are taking pressure off the nerves. And so that is one option. Then we're starting to think about physically or directly taking pressure off those nerves. The next step up is what's called a mild procedure or a minimally invasive lumbar decompression. What that does is you utilize X-ray guidance, but using a much smaller incision, remove the enlarged ligaments, and you even remove some bone off the nerves to just decrease the amount of pressure or open up some space around that nerve. That is done, like I said, with X-ray guidance, and it's much more minimally invasive than a traditional open procedure. And so that would be the next step up as far as invasiveness, for treating symptomatic spinal stenosis. And then you're starting to move into kind of more the traditional surgical realm, and that involves basically visualizing the nerve that is compressed either through an incision or some of the newer technologies that involves using cameras to physically see the nerve, and then use basically instruments to free up the nerve so there's no longer pressure. And that can be in a very effective way of treating pain down the arms, pain down the legs. And then lastly, there's fusion procedures, which is usually kind of towards the end of the line as far as surgical options. And there are a lot of nuances as far as who goes on to have a fusion surgery. More and more we're trying to get away from fusing the spine, and so we're leaning much more on these these decompression procedures, or roto-rooters, you'll hear them called, basically just taking pressure off the nerves. And so those are the main treatment options for people with symptomatic spinal stenosis. Go ahead and look back through the videos for causes of spinal stenosis, and then make sure to subscribe to the channel and see all the new videos when we start talking about other areas of the spine that can cause pain and what the treatment options are. Thanks.